My Lord Lieutenant, High Sheriff, Madam Mayor, Vice Chancellor, distinguished guests and ladies and gentlemen. I'm really delighted to speak on behalf of the NHS providers, partners of the medical school, on the impact the school has had on healthcare in Sussex. Whilst we're celebrating 10 years, and there's been historical links mentioned already, of the success of this medical school, the journey to establishing it goes back over 20 years, and indeed there have been discussions going back decades of bringing a London medical school to Brighton with all the associated benefits to patients. But the discussions in the early 90s were the first on establishing a new school, which paved the way to the school we have today. Over the past 10 years, under the superb leadership of John, we now have one of the most popular and successful schools in the UK. The benefits of the medical school to local NHS providers, and therefore to the quality and range of services we're able to offer our patients, have been profound. Indeed, it's difficult to overstate the importance of the medical school to the Sussex healthcare environment, but I think essentially they fall under three main headings. Firstly, providers have an increased ability to recruit and retain the very best staff across all health disciplines. Secondly, providers have benefited enormously from being able to access improved education and learning for their staff. This has not only been through the education facilities on the two university campuses, but also in greatly improved local education centres, and this building is testament to the improvements achieved. And thirdly, providers have also benefited from greater involvement in research and development, with the opportunity to develop learning and innovation through research and then applying it to practice. But these benefits actually started before the medical school was even established. The relationship between the Royal Sussex County Hospital and the medical school was critical to both, to the establishment of the school and the success of the hospital as an expanding tertiary centre, as well as being the local district general hospital for the city. The benefits to the people of Sussex of being able to have local access to the very highest quality of services, including tertiary, cannot be understated. Initially, we saw an enhanced ability to attract some of the best new consultants across all specialties, some of which were in hard-pressed specialties to recruit to, and this rapidly spread across all the health professions. This continues to be the case today, and we need it to be for the future. In today's NHS, it's critical to local providers as the competition to attract top quality health professionals continuously increases. All our providers have found that health professionals are increasingly attracted to working in an environment rich in learning, development and research. On training, providers have been able to expand their capability and enhance the skills of their existing doctors and other healthcare professionals to train medical students, newly qualified doctors, nurses and other healthcare staff. Equally, students have found the ability to consolidate and apply knowledge gained by working in local providers has offered them great opportunities for active participation and learning in smaller groups. The experience they gain in local providers is invaluable, particularly as the majority of doctors end up working in general hospitals, not teaching hospitals. Equally, all this has enriched the environment in which services are delivered to patients. Providing a good training experience in local providers stimulates the interest and desire of doctors to return to our local hospitals, centres and primary care as their careers develop. In terms of research, local secondary care providers have traditionally lacked a research focus. However, in recent years, all local providers are now actively involved in research. This is exemplified by the partnership between the school and the Sussex Partnership Foundation Trust, where the Trust now has a very strong and flourishing research and development centre and is now one of the top 12 mental health trusts for research in the country. The challenge for all local providers as associate teaching hospitals and trusts over the next 10 years is to take the benefits to the next level. In my own trust in East Sussex, as an integrated acute and community trust, we need to ensure that the doctors of the future need to be trained not only to the highest standards of medical practice, but also to understand the imperative of embracing the strategic shift of appropriate services from hospital-based to community-based, and with our patients having far greater involvement as partners in their care. I believe the importance of the medical school to local providers will increase as the NHS faces the most austere period in its history, with an inevitable change in the landscape over the next 5 to 10 years of how healthcare is delivered in this country. I have no doubt local providers will rise to these challenges and continue to expand their development, involvement and partnerships with the medical school. Indeed, if the health economy is to be successful and sustainable, with patients receiving the care they need, it is essential.